Hello viewers, welcome back to my session. And sometimes life is not easy, especially in the medical field, and you have to go through hell. But if the day determines that you go through hell, you make sure you walk through it like you own the place. I would like to mention that I wrote a novel in 2019. It is called A Moment Called Life. It got published in US and by Page Turner Press. It's a publisher company and somewhere in California. So they published it and it is available in their website, which is pageturner.us, and also in Amazon. If you want to know everything about the medical life, how people live in medicine, so please go through this book. So this is the motto for today, and never give up. My topic for today is to continue with the gallstones. We talked about the symptoms, signs and causes and functions, and we were on Gall syndrome. Now we'll talk about the Wriggler's triad. The Wriggler's triad is nothing but the dilatation of the stomach, pneumobilia, and a gallstone in the duodenum. So these are the basic signs we have spoken about. Now we continue further. In this topic, we'll talk about the complications of the gallstones and what happens if a gallstone is present inside your gallbladder. To understand this, we have to understand that 80% of all these stones are going to go unnoticed. And that is a big, huge amount. That means 80% of all the stones are asymptomatic. They will never cause symptoms to you. Until they cause symptoms, they are asymptomatic. But we have to deal with the 20% also. And how do we do that? We will come to one by one, we will come to each of these points. That, what does the gallstone do? The gallstone usually will cause an inflammation in your gallbladder, and that is what we call as cholecystitis, acute cholecystitis and chronic cholecystitis. And there is another term which you need to know, which is called acalculus cholecystitis. Now, acalculus cholecystitis is where the main cause is missing, no stone is there, and instead of that, you have to practice, probably it's the endotoxin which has caused the inflammation within the gallbladder, or the other reason is usually you have a stasis, a bile stasis, which is caused secondary to a lack of the cholecystokinin function or stimulation. So these are the two basic causes. First is your endotoxin, second is bile stasis. That is what causes acalculus. That means without any stone you have a cholecystitis kind of situation. Now, when you have a gallstone, what happens? How much percentage that? Usually there is, a US study says that there are about 10% of the population suffers from gallstone. So 1 in every 10 will have a gallstone. And what happens, if you remember, you should remember the rule of 12, 6, 3 by 3. Now what is that? 12, 6, 3 by 3. So this 12, 6 and 3 by 3 is nothing, basically 12% of the cases, of the symptomatic cases which you see, will develop cholecystitis in a period of 5 to 7 years. And after that, 6% will require some serious intervention, because these are the 6% that will go into severe acute cholecystitis. And 3 by 3 is basically, it is 3 times more often will be seen in females happening, and 1/3 of these total amount of cases which we are talking about will require surgery. That is the ideal statistics of gallbladder stone. So if next time somebody comes to you and say, oh my god, this is a gallstone, get it done now, tomorrow something will happen, something like that, don't listen to anybody, okay? You have to follow the statistics. You trust your surgeon, I'm sure he will guide you better. He will say that no, you are asymptomatic, you can wait comfortably. But there are certain things which we need to know about this symptomatic and asymptomatic thing. See, if you are having pain, if there is a indication that this is a sign of gallbladder, so that becomes symptomatic. Don't avoid it, don't confuse it with bloating and just had a heavy meal, so this happened. It will not But you can make out in a subsequent fatty meal later on, you will find out whether it is because of that or not. And acute cholecystitis, the pains are usually very severe on the right side. Okay, and then you have other features. If it is associated with cholangitis, you will have other features which we talked about, like fever and jaundice and altered symptoms. So what happens is that it is your personal call. At the end of the day, it is your call. If this is due to gallstones and your doctor is telling you that yes, this is due to a gallstone, then should be called a symptomatic gallbladder. So there is no any hard and fast rule that you say that wait, this is not due to gallstone or not. So asymptomatic means no symptoms at all which are relating to whatever we talked about in the previous session. So that is asymptomatic gallstones. Symptomatic gallstones need to be treated. So we go ahead, we have to talk about what this can cause, what are the complications. I'll just enumerate them to you and then we will talk about this cholecystitis, acute and chronic cholecystitis. Okay, so in this cholecystitis, what we see is you have an acute cholecystitis, you have a chronic cholecystitis, and then you have an acalculus cholecystitis. Acute cholecystitis, you will have a differentiating features in that. There are stages in it. Talking about in gallbladder inflammation is that there are basically, you say, 3 stages followed by the chronic cholecystitis stage. 3 stages you have is your edematous, necrotizing and suppurative. Edematous is where the edema is setting in, then necrosis which is setting in, then it is followed by a suppurative stage. This can also be described as your stage 1 is where you have the inflammation that is limited to the gallbladder. Stage 2 is where you start having any pericholecysttic abscess or any gangrene there. And stage 3 is where you can even have an organ failure, which is a very severe stage. So this is mild, moderate and severe also, we can define like this. So these are the stages basically. Days also matter a lot. 2 to 4 days, 5 to 7 days and 7 to 10 days. So this is your 1, 2 and 3rd stage. After 10 days it continues, it's going into a chronic. So these are the stages. What are the complications that can happen? What the certain terms which we use, that is empyema of the gallbladder, it can lead to rupture, it can lead to gangrene, and then it can lead to this thing, pancreatic. This pancreatitis. We go back to the revision that we've talked about the signs and we've talked about the basic problems that occur with gallstones and the complications of gallstones. Now, how do we treat it? Basically, ultrasound. And ultrasound, there are 2 types of stones which come in. That is you have the cholesterol stones or you have the pigment stones. Even at ultrasound, you get a feeling that this is a cholesterol stone or this is a pigment stone because if you look at the stone carefully which is coming, it is having any internal echoes and post-acoustic shadow. So that is more indicative of a cholesterol stone. If it is just lying there and it is smaller in size, so these are more usually pigment stones which are present there. So you can find out what stone is there and how many stones are there, whether it's multiple calchloride or whether it's single, which is called as a cholesterol solitaire sometimes. So these are the terms that are mentioned and given. And then you have other modalities. You can do a CT scan also if you see that it's progressing into a higher stage. You can do a CT scan to find out whether there's infiltration into the neighboring structures or not. And then finally what you can do, there are other tests. People even do an MRI in this. But usually you can make out with an ultrasound very comfortably whether this is a gallstone or not. The rest you can continue with that. And then you have anything that one test which can, it is a technetium HIDA scan. HIDA is hepatobiliary immunodiacetic acid scan, in which the excretion of the radioactive dye, you can make out what is the ejection fraction. And if there is a delayed visualization of the gallbladder, then that means that there is a cholecystitis which is present, chronic cholecystitis. So these are the tests: ultrasound, HIDA, CT, MRI. Through this, we reach a diagnosis that the patient is suffering from cholecystitis or gallstones related problems. Management changes. If there is stage 3, then it goes into then you need a multi-speciality unit. You cannot handle it in a single place because then you have other cardiac symptoms getting involved, respiratory symptoms are going to come in, and so you need intensive care units to monitor such cases. Stage 1 you can comfortably do wherever you are, and stage 2 and 3 you would require some assistance. Okay, we stop here.